So you've been told that you need a dental implant. Maybe you have a dental implant or just curious about dental implants and how do people take care of them. Let's get into it. Dental implants is made of typically titanium because it is biocompatible to the body. It's a screw-like material that is surgically placed in the mouth. It's surgically placed in the bone, and if integrated nicely, no complications whatsoever, it will outlive you. People usually get them in place of missing teeth, depending on how many they need. Sometimes they'll have a whole mouth of implants. Sometimes they'll have just enough implants to connect a bridge or connect a denture that they can remove or be permanent. Basically, an implant is a replacement of a natural tooth to function like our natural teeth. And if your dentist is recommending a dental implant for you, it's because it is truly one of the better options. Is it expensive? Absolutely. It's probably the most expensive compared to partials and bridges and dentures and all that. But it is going to be the closest to having your regular tooth. All right, so fast forward, you got a dental implant. Now, how do we take care of it? All right, let's talk about brushing. Soft-bristle toothbrushes. It doesn't matter if you have natural teeth, non-natural teeth, crowns, whatever. Soft-bristle toothbrushes are the way to go. Now, if you just got your implant and you are fresh, everything is still in that healing process, your periodontist, which is the gum specialist, or the oral surgeon, is going to send you home with a toothbrush that kind of resembles feathers. It's going to be extremely soft. It's going to feel like you're not really brushing any plaque away, but it's because they want to make sure that the healing process is going the way it should be. Everything's properly healing. Now, depending on the specialist, they may tell you to hold off on using an electric toothbrush and use a manual, but that's totally depending on who they are. But soft bristle toothbrushes are the way to go. Okay, let's talk about flossing. Okay, so I'm a visual learner, so let's do this together. Let's bring your hands up, do a little stretch, and make a heart shape and land here and smile. Okay, just kidding. But imagine your head, my head, as the implants. Remember, implants, although they are replacing your natural tooth, they aren't going to look exactly like our teeth. They're not going to have roots or anything like that. It is a screw-like material. So it's skinny. It's a skinny material in the bone. And my hands are going to act as the bone, the tissue. And this gap that you see here, that is where plaque, bacteria, food debris is all going to get harbored in there if we don't clean it out. So this is what your implant looks like in the mouth. How do we clean that? So when it comes to string floss, you may want to find something a little bit more textured because the implant space is a little bit wider. So the more textured, the better. So that way you can grab a hold of plaque and food debris. Another way to clean in between your implants are proxy brushes. Now, you may call them little trees, or you may call them baby bottle brushes. They're basically this little brush that you can bend whatever angle to get in between the teeth. They're really great when you're on the go, and they're also thick enough to really grab a hold of whatever is lodged in between your implant. And last, my favorite, which is an oral irrigator. This is a water flosser. This is an amazing tool to really flush out, blast out whatever you have in between your implants, your crowns, your bridges, literally anything. This will kind of make you feel bad, like you're not a great brusher when you pull this out and you realize there's still stuff in your mouth. This will really just clean your mouth. But of course, you want to make sure with your periodontist or your oral surgeon, if you can use this after you get your implant, they might have to let you hold off for a moment because it is pretty strong. Now, when it comes to mouthwashes or mouth rinses, water is usually the best when it comes to just rinsing out. You may have a prescription rinse that your doctor will prescribe for the healing process. Everyone's a little bit different. Non-alcoholic rinses are a little bit less abrasive to the implants. So talk with your dental professional to see what options there are for you. All right, so let's talk about other dental considerations when it comes to dental implants. We talked about soft bristle toothbrushes, but we need to talk about what we're using when we're brushing our teeth. Are we using toothpaste that's a little bit abrasive? We got to be a little bit cautious, especially when we're having dental implants. We want to make sure we're not using anything that's going to cause corrosion to our dental implants. Speaking on corrosion, there are some studies saying that fluoride might be a cause factor when it comes to corrosion to dental implants. Fluoride is still good. Don't freak out. We all still love our fluoride, but it's mostly talking about people who are using prescription fluoridated toothpaste or a very high concentration of fluoride for prolonged use. So if you're using that and your mouth is at a level of acidity that is pretty severe, that and the fluoride can cause a reaction to your dental implants, which can cause corrosion, metal discoloration. That could also lead to adverse tissue reactions that you definitely don't want. So it is really important that you talk with your doctor, your dentist, your dental professional to see what alternatives, what tips, recommendations that they have that will be beneficial to you. Another consideration is to not smoke. It does slow the process of healing tremendously. It even weakens the bone, making it even harder for the implant to fuse properly into the bone. It can cause infection, it can cause inflammation. Basically, smoking is super detrimental to dental implants to the point where you could lose the implant altogether. So, if you're a smoker, just know that you're spending all this money on an implant and you could possibly lose it. So if you are getting implants, better just to not smoke or use any tobacco products at all. And for my ice chewers out there, this might hurt a little bit, but chewing on ice can also be very damaging to your dental implants. It can cause cracking, weakening of the bone around the implant. So it's very important to really moderate on your ice chewing or try to stop the habit if you can. Thank you guys for watching this video. I hope it was super informative. If you are getting a dental implant, I hope the tips and recommendations are helpful. And please share your experiences down in the comment section below. Now, if you've already had a dental implant, we love to hear your story too. Please like and subscribe to the channel so that way you can stay on top and alert for new videos coming every week from Burst TV. Bye.